Let me hand it back to the gentleman from Colorado, and I yield to the gentleman from...
I thank the gentleman from Minnesota. I rise to share stories of real people that highlight the need, the urgent need for health care reform. Eileen Fink of Colorado Springs is what we might think of as a soccer mom. Her kids, she told me, have a reputation for being involved in sports. They're a healthy and athletic family, but they, like many American families, lost their health care insurance. But, you know, they encourage their kids to power on, play sports, have fun, live a normal and happy childhood. No one in their family was reckless, but they had a bad year when they racked up several orthopedic injuries in a short time with no insurance. This could happen to any family. Their daughter racked up over $10,000 in bills after a fall that required reconstructive surgery and steel rods in her bones. Their other daughter fell ice skating, broke her wrist. That was a $3,000 bill. Finally, their 14-year-old son broke his wrist. He broke his wrist, and feeling sorry for the family financial predicament, he hid that for 9 days. He didn't tell his parents that his wrist was in pain or what he was suffering from. One night he finally said, "Mom, I think I broke my wrist a while back, but I didn't want to make you cry about the bills." Turned out it was broken on a growth plate. And the police came to question Eileen about the delay in treatment. Ultimately, it was her son who tried to protect her, his own family, from the bills, hence the delay in treatment. What does that teach him about access to health care? Eileen feels terrible that her son suffered so long trying to save the family financially. Eileen asks us in Congress to help hardworking families like hers. And she added that, by the way, my husband is Republican, but sees this as an important issue too. Families are bipartisan. Families are nonpartisan, whether they're registered to vote, whether they vote, whether they're Republican, whether they're independent, whether they're green, whether they're libertarian, whether they're Democrat. What kind of system forces a 14-year-old kid not to tell his parents that he's hurt because he's worried about his mother crying because they can't afford the treatment? Under health care reform now before Congress, families like the Fink family would have the option of getting insurance through the exchange, a low-cost option that people who are self-employed or work for small businesses would have, that would give them the same negotiating power and leverage as multinational corporations. Families like the Finks would also receive affordability credits and have the guarantee that they would have no more than $10,000 out of pocket in medical expenses each year, preventing them from bankruptcy and from having to worry their children about the costs of medical care. It's urgent that this United States Congress keep families like the Finks in mind, soccer moms and soccer dads across the country, any of whom could be affected by the breakdown and the failures of our current medical system. It's for families like the Finks that I call upon my colleagues in the United States Congress to pass health care reform and send it to President Obama's desk before the end of the year. Thank you, and I yield to the gentleman from Minnesota.